Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I'll be the host of the program this evening, and I'm so glad that you joined us. If you're one of our regulars, I know you know the routine. We're live here in the studio, and we love when people call in and ask questions. We have a live guest with us tonight, a surgical oncologist, and the topic is pancreatic cancer. So a lot of things to learn about tonight. If you're new, let me kind of explain how it works. Obviously, the phone lines are open now. That's why we keep the number there at the bottom of the screen. So call anytime now. It's 969-2720. It is still a free call if you're outside of Fort Wayne, and some of our viewers are, so just put an 866 in front of there. And then you can talk to a call screener, and you can ask the question live, which is great because that way the doctor can ask you more questions. Maybe it would help him to have more information to give you a better answer. So that's your first option. Second option is you can still talk to the call screener, but you can relay your question to him, and then they'll give it to me, and I'll get the question answered for you that way by asking the doctor for you. And a new feature that we just started a few weeks ago is texting. So that's a little different number. And again, we're keeping that up at the bottom of the screen too. Again, 969-2730. And I want to assure you that it is confidential. We never show your phone number. We keep that all private. You can text in your question. If you feel comfortable doing so, it's always nice if you put your name and maybe what town you're from. That's great, but you don't have to. So I just want to reassure you, if you have something you'd like to have answered, don't hesitate to do the texting method because it is confidential. We keep all your information private. Well, let's go ahead and meet our guest. We have a new guest this evening. This is Dr. Philip Bao, and you are a surgical oncologist.
That's right.
And we are talking about pancreatic cancer, which I've got to tell you, I was talking to some friends today, and they were asking what the topic was going to be this evening. And when I told them, they all said, "Oh gosh, that's so sad." They both said everybody I've known who's ever had pancreatic cancer did not beat it. You know, we hear about people, you know, I beat breast cancer or, you know, prostate cancer, but you don't hear about people beating pancreatic cancer. Do you think it's fair to say that?
Yeah, and unfortunately it has a very aggressive reputation.
Yeah.
And so thankfully it's not as common as some of the other cancers out there that affect people like breast cancer and colon cancer, but it's certainly one of the most deadly cancers. It's actually the third leading cause of cancer death in the U.S. For Indiana, that translates to about 1,200 people a year dying from this cancer.
Is there a stereotypical description of a pancreatic cancer patient? Somebody maybe with comorbidities or lifestyle, age. I don't know if it's more common in men than women.
Yeah, it's probably evenly distributed between men and women.
Okay.
It is a cancer of older patients, older people. So typically the patient is in their 60s to 80s, but we've seen people in their 50s or even as young as 40. Risk factors for this cancer aren't so well defined. I mean, it's associated with smoking, associated with long-term diabetes. There are some genetic dispositions, some families that you'll see pancreatic cancer run in, along with some related cancers like skin cancer or even breast cancer. But most of the time we can't really pinpoint a specific factor.
Yeah, I wondered what the symptoms are, because, you know, in both of the people that I knew, it came as a complete surprise to them. You know, they weren't really sick. Yeah. You know, it was, well, with my grandma, that's, somebody just commented to her, a nurse was a customer in the store when my grandma was still working at age 86. She worked at our family's store, and just commented to my grandma that you look really yellow, and I really think you should go to the emergency room or be seen by a medical professional. But that was it, but my grandma felt fine.
Yeah, so that's sort of the classic textbook presentation. If somebody suddenly turns yellow, their eyes turn yellow, their skin turns yellow, maybe they have some itching, but they don't have any pain or any other symptoms. That would be one, again, the sort of classic symptom, but it can be very subtle, such as just unintentional weight loss over a period of 3 to 6 months, some vague pain in the upper abdomen, or progressing to problems with eating and digestion. But it can be very, very sort of low-key, if you will, and attributed to other things like aging or just the time of year, that kind of thing, and it can take a really astute primary doctor or family member picking up on those changes.
I was going to ask you, if that's something that, hopefully most people are going once a year to get a checkup. So would there be anything in general that your primary care may check for, or is there really even something that, you mentioned if they're astute enough, something may stand out? So.
Yeah, so unfortunately there's no screening test. I think that's important. So unlike a mammogram for breast cancer or colonoscopy, there's no real recommended screening. That being said, if you have a suggestive family history, or again, like I mentioned, some of these subtle signs, like maybe a worsening of your diabetes, or if you're an older person and now you've suddenly been diagnosed with diabetes, that can be a flag. And I think the most important one that can be maybe picked up early is that subtle weight loss that you don't really otherwise have an explanation for.
So I'm assuming it differs depending on all sorts of factors, the person's age and health situation. But in general, is there some protocol that, if you suspect it, how do you even diagnose it correctly?
Well, certainly if somebody has that yellow jaundice, then that can be confirmed with blood work. And there are some markers associated with pancreatic cancer that can be checked on the blood. But really the way to diagnose this is usually with a CAT scan. So an imaging study or an X-ray study of the CAT scan looking at that belly area where the pancreas is, and that can be followed with an MRI and some other types of tests to pinpoint where the problem is.
Does it tend to just be a mass in the pancreas, or does it change in appearance? Like, how would you know when you're looking at a scan of it that cancer is present? Well,
these are what we call solid tumors, so they are usually measurable. Sometimes if the scan isn't done correctly, you may not see it very well, but at least you can see maybe some of the effects of the tumor. And then there is one other study I should mention. It's a type of endoscopy. So it's where a gastroenterologist uses a specialized camera with an ultrasound to look at the pancreas, and they can often see these tumors very well.
So where do you go from that point? I guess it depends maybe what stage the diagnosis comes back as.
Yes. Again, a typical pathway might be one of these endoscopic procedures that can get a biopsy, and then once that confirms the tumor, the cancer, then it's what we call a multidisciplinary process where you might see a surgeon, you might see a medical oncologist, a cancer specialist that then can complete that workup to figure out what stage you are and what are your treatment options.
Okay. I just want to remind people quickly, Dr. Bao, that our phone lines are open. We haven't heard from anybody yet, so you can phone in a question. You can ask it live. You can have the call screener. Let me know what your question is, and I can ask it for you. And, of course, don't forget now you have that texting option, which is really nice. It's really quick and simple, and, again, it's private because we don't show your number or anything. If you all want to offer up your name and where you're calling from, that's great, but you don't have to. We only have Dr. Bao here for a short time, just a little before 8 o'clock, and the show will be over. So please take advantage of calling. Maybe you know somebody who has pancreatic cancer. Maybe it runs in your family. You'd like to find out more information about it. You can't beat it getting free advice. So please call us anytime. Feel free to interrupt us during our conversation at any time. The two people that I knew who had pancreatic cancer, one of them was my grandma, they supposedly were not candidates for surgery. So I was wondering if you could expand upon that. When would surgery maybe help the patient?
Yeah, so again, just along the lines of this being such an aggressive cancer, and often it might be picked up late. Surgery would be the goal. I mean, that would be a chance to potentially get cured. But maybe only about 20% of patients when they get diagnosed are candidates. And how we decide that is whether it's spread outside the pancreas. That's one factor. And then also if it's involving any of the other organs or key structures around the pancreas that can make it either safely removable or completely removable. If it can't be removed under either of those circumstances, safely or completely, then there's very little benefit to surgery, unfortunately.
Is that when you would turn to maybe something like, I don't know if there's medication or if you do the chemotherapy, radiation?
Yes, so then your options would be, for example, chemotherapy or radiation. But the truth is, if you're a candidate for surgery, you're still going to get a recommendation typically for chemotherapy too, because we want to be aggressive about treating this in any way we can, and then sometimes radiation as well.
All right. Well, we did have somebody who texted in a question, so I don't see there. Oh, there it is. They wanted to know how to potentially prevent getting, pancreatic cancer, like a preventative lifestyle. Any suggestions you would have?
Yeah, good question. Unfortunately, no great solutions. In terms of looking at the risk factors, clearly smoking cessation, and obviously that has implications for lowering your risk of lung cancer too.
Okay.
So I would suggest smoking cessation clearly is a good one. There is a relationship of chronic pancreatitis or inflammation of the pancreas and pancreatic cancer, and certainly excessive alcohol use is linked to pancreatitis, which in turn can be linked to pancreatic cancer. So I think moderate alcohol, social alcohol use, probably okay, but certainly not alcohol abuse or excessive alcohol use.
And we hear that so much on this program from physicians in all different specialties that just say, live reasonably, don't do anything to an extreme, and you should be doing the best that you can, Sometimes, like you said, this can be hereditary. Do you feel like it's, when it comes to being hereditary, does it tend to affect one sex over the other? Like, does it tend to run more in the males or females?
Yeah, no, I think it's still pretty evenly distributed.
Is it?
Yeah.
Since you were mentioning that it's hard to diagnose early because there are no red flags that really jump out. So you may be in a more advanced stage. If somebody decides not to do anything, and maybe given their age, maybe it's somebody who's quite elderly and doesn't want to do any more treatments, does it typically, can you give somebody a time frame as to how long they may be able to live with it?
Yeah, it's tough. That's a tough conversation.
Sure.
Untreated, completely untreated and just with supportive care measures, but no chemotherapy, no radiation, no surgery.
Yeah.
You really are talking about a survival that can be just on the order of a few months, or 6 to 12 months. That is the unfortunate statistic behind that.
You mentioned that a lot of people don't feel any discomfort. We talked about the one classic symptom was somebody looking really yellow, skin looking really yellow. As it progresses, though, does pain become more of an issue?
Yes,
it does.
It can be. What happens is the cancer starts to irritate or infiltrate towards the back where a lot of the nerves are, and then you can have more issues with pain.
Okay.
And so certainly that is an area that can be addressed, though. Even if you're not getting treatment for the cancer, there are we have, for example, a palliative care service that can prescribe medications or use procedures to help manage that pain.
Yeah, we've done some programs with people who work in hospice and palliative care, and just to reiterate that those physicians can prescribe things that are stronger for those, specifically for those kinds of patients, just to keep them comfortable. So, Doctor, we did have somebody else text another question. So, somebody wanted to know if there's been an increase in pancreatic cancer over the last 10 years, or apparently they're suggesting that it has been an increase, and why would that be?
Yeah, I don't know if I have a great answer. I mean, clearly, I think with, if you want to call it our epidemic, if you will, of diabetes and obesity in the country or worldwide, I think that's part of it. There also are going to be links to environmental exposures, chemicals, pesticides. I think that is applicable not only to pancreatic cancer, but many of the cancers that we're seeing more frequently or in younger patients, like colon cancer. There may be a little bit more knowledge. I mean, certainly there are more GI specialists, and so it's more being picked up. So instead of, my grandmother was diagnosed with a cancer, but we don't know what kind of cancer, and she died, and so now maybe we're a little bit more specific about what that family member died of.
I was curious to know, suppose somebody is a good candidate for the surgery, and then doing follow-up chemotherapy. Have you come across patients that have, still lived for a fairly substantial amount of time afterward? I don't know if that, I have not myself familiar with anything like that, but.
Yeah, the way I like to explain it to patients is, unfortunately we're not necessarily hitting home runs, but we do the best we can. And so with best treatment, with surgery, with chemotherapy, you can see a cure rate, but that is on the order of maybe 10 or 20%. And so when I say cure means, alive with or without cancer, or without cancer after about 5 years.
Okay.
So it's not a great number,
No.
but it's certainly not zero. And so that's the best we can do at this time.
And we hear so much about, breast cancer, prostate cancer, lung cancer. I feel like there's a lot of public service announcements out about those and all kinds of, walk for a cure, things like that. We dedicate, like the month of October is Breast Cancer Awareness Month. You just don't hear a lot about pancreatic cancer. Is it because, even just one person dying is too many, but because compared to other cancers there are fewer patients? Is that why maybe there's not as much out about it? Or I don't know. I don't know what the status of research is.
Yeah, well, it's certainly an active topic of research. I think the problem is just the success finding the right medications, better chemotherapies. It just hasn't happened just because the nature of the cancer. There is Pancreatic Cancer Awareness Month.
Is there?
I believe that's November.
Oh, okay, I'm glad you told me that.
And just like breast cancer is a pink ribbon,
Yes.
pancreas cancer has a purple ribbon.
Okay.
And there are definitely foundations and national networks and support networks that are definitely focused on pancreatic cancer research and treatment and resources for patients.
Okay, all right, good to know. I'm going to read another question that somebody texted in, but I want to remind everybody you can call in your question, you can text it in to us, so please take advantage of that before the show is over. So we got a text asking, is pain on the left side after eating an indication of pancreatic cancer?
Yes. Yes, the potentially,
Okay.
I guess. It would be compatible with that, but you would have to link it with other symptoms. For example, is this happening all the time? Is it associated with weight loss or nausea? What might be happening, for example, is if somebody eats, then it activates or irritates the pancreas, and in the setting of a pancreatic cancer, then that might be worsened. So certainly not the only symptom and not very specific, but I guess it could be compatible with that.
I guess if you have any concerns, is a good starting point just with your primary care doctor. I mean,
Yeah.
not necessarily going to a specialist right away, just...
Right, yeah, no, if you went to your primary doctor with that kind of complaint, then they may check some blood work, they may recommend a CAT scan, and then you go from there on the findings.
All right, good to know. I wanted to ask you why that symptom, you said the classic symptom about the skin and eyes turning yellow, what causes that?
Yes, that's all based on the anatomy. So the pancreas is an organ in the upper abdomen, the upper belly, and the front part or the head of the pancreas is very close to the bile duct, and the bile duct is a tube that connects the liver to the intestine, and it carries bile, which is a digestive juice.
Right.
And it happens to be green to yellow.
Yes, yeah.
And so when you have a cancer in the front part of the pancreas, it can block that duct. And so that bile backs up, and that's what causes the yellow jaundice.
If you're to that point where you're looking yellow, is it typically, I don't even know if you can kind of, make an estimate as to maybe how progressed it is at that point, if you've got that symptom?
Yeah, actually, that might be a blessing in disguise, because that might be an early sign of pancreatic cancer. If the tumor is in another part of the pancreas where it doesn't cause a blockage, it may have time to grow and spread and cause just those vague or subtle symptoms before it comes to medical attention. So actually, a painless jaundice, like I said, might actually at least present you earlier to medical attention.
All right, maybe give you a few more options at that point. So let's see, we had another text question, so I'll do that one first. The question was, why is pancreatic cancer so aggressive? What is it about it?
Yeah. Yes, the term we use, it has this aggressive biology, and why is that different from a breast cancer or a colon cancer?
Yeah.
And it's just, I don't know if anybody has a great handle on the why, but it's how it reacts with the body around it, with the tissues around it, that somehow, perhaps the best way to express that is it can evade the immune system to not have the body react to it or help control it. It has access to the lymphatics and the blood vessels and just ends up being more apt to spread in a faster time frame than perhaps other cancers.
All right. And I'm going to go ahead and take another text question if I can. So somebody had written in that their father had died of pancreatic cancer and was wondering what their risk factor would be. And I guess the person's saying that they're a non-smoker, so not smoking, and a man.
Yeah, so I think we do see pancreatic cancer run in families, and so it's actually a standard recommendation now for any patient who is first diagnosed with cancer is to consider genetic testing, talking with genetic counselor to get, for example, blood work that can screen for certain changes in your cells that can be linked to cancer, and so that is important to know. Again, we're not quite there yet with recommending, for example, earlier screening, but at least genetic counseling to identify, if not, for example, your father, but other family members with maybe related cancers. And if that whole picture suggests that you might be higher risk, then definitely there are high-risk programs out there that can help with screening and getting you in touch with the right people.
Because, we hear so much about the genetic testing. I feel like for women, they want to know if they've got the breast cancer, the BRCA, A gene. So I'm just wondering, if you did that route for the pancreatic cancer, I mean, does it really help you? When you were saying once you're diagnosed, you a lot of times don't have a lot of options. But what could that genetic testing do? Just allow you to catch it maybe earlier?
Yeah, no, that's right. I mean,
So,
even though there may not be a recommended schedule screening, once you are identified as maybe higher risk, then yes, you might be recommended to have an MRI of the pancreas every year at a certain age.
Oh, okay.
And so early detection can be helpful.
I'm going to ask your help for this. We had somebody else, a gentleman named Tom, called, and he wanted to know if under I'm not sure that methylation play a role in the development of pancreatic cancer. I'm not familiar with that word, or I'm not sure if it's the correct word.
Yeah, I'm sorry, I'm not either.
Yeah, okay, all right.
Can resubmit it?
Yeah, if you guys want to Tom, if you're out there, I'm not sure. I thought maybe it was a medical term that I just wasn't familiar with, so. If Tom calls back, we'll try and get that one answered. So we only have a minute or two left in the program, and we don't have any questions right now. We could quickly take one if you guys want to text one in or call. We have 2 minutes left. But in general, any tips you can give to people? Because, I didn't even think about having any type of a screening available. Maybe like my parents are older, they're both going to be 80 this year. I'm not sure if they're thinking about it because we've only had one person in our family with it. What are some things that maybe I should have them advocate for when they go to the doctor?
Yeah, I think you just need to, in some ways, advocate for yourself. Again, sometimes those subtle symptoms can be ignored or attributed to other issues. But if it really is persistent, lasting 3 months, 4 months, 5 months, then it really takes, talking or trying to talk to your doctor about it, or trying to talk to your nurse practitioner about it, and make sure that there is a clear explanation for why that's happening.
All right, I'm going to try and see if we can answer this one text message really quickly. Somebody wanted to know if a tiny spot detected on the pancreas, how often should that be monitored?
Yes, so The short answer is it depends. There are certain characteristics that we look for. There might be cysts, there might be other findings in the pancreas, and there are some clues in terms of what it looks like as to what are the chances that this could be something now or could turn to something in the future. And so certainly if there is what we call a growth that may be associated with a future pancreatic cancer, then there are programs where we can monitor that. So that might be, for example, an annual MRI and checking certain blood work to make sure it's not changing.
All right. Well, Dr. Philip Bao, a surgical oncologist, so great to have you on. I feel bad the show is over, but we had a lot of questions tonight, so at least gets people thinking about it anyway. So
my pleasure for being here. Thank you.
Thank you so much. And thank you to all of you for watching the program and for joining us with your questions. We'll be back next week. We have an orthopedic surgeon joining us next Tuesday, so we'll see you then. Take care. Bye-bye.
PBS Fort Wayne was made possible in part by...
You gotta find your people.
Good morning.
The ones that make you feel whole.
Good. How you feeling?
You look so pretty today.
Bring it together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.